Today, we are here with fibroid doctor Cathryn Shaw, MD, of the Fibroid Institute. We are very excited to have her interviewing with us today, and we are going to be asking her some questions so that fibroid patients can get to know her virtually before they see her for their appointments. So, welcome, Dr. Shaw.
Hi, thank you for having me.
Sure. So, can you tell us, Dr. Shaw, when did you first decide to become a doctor, or kind of what personal and professional path brought you here?
Well, I grew up in a very healthcare centered household, and my dad, who's a dentist, actually encouraged my brother and I both to go into medical school from a very young age. When I got into college, I got a mathematics degree, and I thought that I wanted to be a math professor. I taught high school for 1 year and quickly realized that that probably wasn't the best choice for me. And so that is when I made the decision that I wanted to go to medical school and pursue a career in medicine. My brother, who's 5 years older than me, is also a physician.
Wow, that's amazing. So it's a
Mhm.
family of doctors.
Yes.
Um,
Yes.
so what are you most passionate about professionally in your field, not just medical, but your specific, you know, uh, focus?
Gotcha. I finished fellowship in 2011. And initially in my career, my area of expertise was post transplant intervention. I did everything, including uterine fibroids, since the beginning of my career in 2011. Over the last several years, women's health and specifically minimally invasive treatment options for uterine fibroids has become my primary focus in my career.
Wonderful. That's great. And sounds like your path led you to this place. So what are you most proud of regarding your practice's success or accomplishments, or the impact that your practice has on patients?
I'm most proud of being able to offer very high end specialized interventional radiology to our patients. Our entire group of doctors is very highly trained and very skilled. We offer top notch quality of care, and all of the physicians that are involved in our practice are as qualified as you can get anywhere in the country.
Wow, that's amazing. And so, what do you think are some of the biggest challenges that you and your team face regarding, fibroid treatment or fibroid patients?
I think honestly, the biggest challenges we face are educating patients so that they know what all their treatment options are. Not all women with uterine fibroids are presented with all the treatment options when they're diagnosed with fibroids. Luckily, with the internet and Google, patients as a whole are becoming more educated and informed individually. I really do think our biggest obstacle is educating the public about all of the treatment options that are available to patients for uterine fibroids.
Okay, yes, that is, we've heard a lot of patients say that they didn't know that there were other
Yeah.
options. They were only given one option. They were maybe told to have surgery, and only when
Yes.
they start asking around, seeking out second opinions, or researching themselves on the internet and forums on social media is when they realize that there might be other options. So I
E exactly, and this is not uterine fibroid embolization is not a new treatment option. It's very well documented and studied, since the '90s as a standard of care for minimally invasive treatment, for uterine fibroids. So this is not some new, technique or procedure. It's been around for a long time and has a lot of data to back it.
That's encouraging to know and to find out, and probably very encouraging for these patients that were told they'd only had one option and they feel kind of stuck between that and
Yes.
being miserable. So that's great. And what about the patients who don't know that they have fibroids? You think that's challenged too? Meaning they have some symptoms.
Yes, but I do think that most people in today's age get diagnosed because they have imaging in all gynecologists have transvaginal or pelvic ultrasound. So if you come and you present to a gynecologist and you have these symptoms of, pelvic pain, heavy periods, other symptoms, oftentimes they're going to get a pelvic ultrasound in the office, and that is how they're going to find out they have uterine fibroids. Of course, there's a small subset of patients that have had symptoms for so long and they haven't sought medical care, so those women wouldn't know that they had them. But I do think most people get diagnosed when they present to their gynecologist because imaging is so available and so common now.
So the moral is, or the message is, don't wait, don't
Exactly.
suffer, go seek out your gynecologist or your primary care physician. Don't just live with these symptoms thinking they're just part of normal being a woman. Don't normalize them. So,
Exactly. Exactly. If you have symptoms that interrupt your daily activities, you definitely need to talk to, be it your primary care doctor or your gynecologist about it.
okay. And how do you develop relationships with these patients to communicate kind of like you're on their side, you're on, you've got a team and you're with them. What kind of wisdom or words of wisdom do you offer to them?
Well, I grew up in Mississippi and I pretty much have never met a stranger. So I don't have much trouble, connecting with people and talking to people. The main thing I think that is the most important for patients to have faith and confidence in their physician is knowing that the physician is on their side and all the decision making is going to be done together as a team. And I always give my patients every, treatment option that they have available, and I want them to make an informed decision. This decision shouldn't be being made, you know, solitary by the physician. This is a team effort, and we want to do what's best for the patient in that specific clinical setting.
Great, perfect. I'm sure many patients are relieved to hear you say that. Having you on their side and having you go over all of their options and not just feeling they're so they're not feeling lost in what they're going to do
Right.
is certainly a relief to them. Do you have a
And if
favorite?
they, well, and I was going to say, and if I don't think that fibroid embolization is the best option for them, myself and my partners are always willing to refer them to someone that can help them.
Okay, that's good. And do you have a favorite philosophy that you share with patients?
Ever since I started medicine and went to medical school and got out and started practicing, my number one philosophy would be to always treat patients exactly like I would want myself or my family members to be treated. As a physician, you're not going to make a wrong, decision, um, or treat a patient illy if you are actually treating them like you would want yourself or your family members to be treated.
Hey, that's wonderful. And what are you going on to like a personal level to help patients kind of connect with you? Do you have anything you're passionate about personally? Any hobbies to share?
Sure. I will be married 24 years this summer. My husband and I got married quite young. We're high school sweethearts. And we have boy girl twins that will be 16 in May. So I'm definitely most passionate about my family. Together, we love to travel. We love to play Cube and other games. I love to cook. Cooking for me is actually very enjoyable. And I also do a lot of Pilates.
Awesome. So then you can, advise patients on their overall physical well-being too, because exercise could be important for them. So,
Absolutely.
all right, and to follow up or to end the interview, is there anything else you want to share about yourself or your practice or the treatments or anything like that to help patients connect with you?
Absolutely. Like I said earlier, I've been practicing interventional radiology since 2011. I've always done fibroid embolization on top of the other procedures that I offered. But I think the main standout and the difference of this practice is the concentration on this one disease process. Everyone in our office is informed and educated about, the uterine fibroid embolization procedure. We are doing everything in our power to stay up to date with treatment options. We offer more of a concierge experience in that every patient gets their doctor's cell phone number, and we encourage our patients to reach out to us, to text us if they have any questions. And the level of pain control that we get with our block that we do in our practice is honestly a game changer in post-operative pain management.
Oh my gosh, that's amazing. I'm sure many patients would be excited to hear that. And, pain and the management and the concierge level service that you provide is something probably, like you said, unmatched in the industry.
Right.
So
Exactly.
it definitely is, innovative, novel, game-changing approach to treating fibroids. So we thank you so much for that, for your dedication, for your compassion, and of course your skill level and your education and experience. We so appreciate that. The community probably appreciates that. So thank you so much, Dr. Shaw. This is Dr. Cathryn Shaw with Fibroid Institute, and we're going to end the interview, and we thank her for her service.
Thank you so much. I enjoyed talking to you.